February 2023, we are running a multidisciplinary cerebral palsy clinic in Mangochi district, Malawi. Currently, we have 4 clinics. Within these clinics, patients are seen by a multidisciplinary team that includes physiotherapy, nutrition, pediatric, medical care, and health education. All patients receive a personal health record that is used to make personalized goals and allows for proper follow-up. Every patient will be taken for nutrition assessment by measuring length, weight, and MOAC. This is important because more than half of our patients are malnourished and need to receive food supplements. Food supplements for moderately malnourished children are not readily available within the Malawian healthcare system and is a great benefit for children coming to the clinic. After the nutrition assessment, the children and their caregivers will go for health education. Here, they will learn about different topics that are related to cerebral palsy, starting with what is the condition, how does this impact daily life, and how do you take care of a child with cerebral palsy. These topics are discussed in groups so that the caregivers can also share their experiences with peers. A nutritionist will take a more thorough history about how the child is eating and drinking. More than 85% of the children with cerebral palsy have swallowing difficulties, and during this session, mothers will receive education how to prepare different food consistencies and different recipes. During the session with a physiotherapist, an assessment is done and personalized goals are formed in agreement with the caregivers. These goals are based on improving daily activities and participation in the family and community. During the session, the caregiver and the therapist will work together with the child to achieve the goals that are set. These goals will be followed up in the next visits and adjustments is done when needed. The medical team will check for comorbidities like epilepsy and frequent upper respiratory infections, and will also look at preventive medicine. Within the Malawian health system, drugs are often out of stock, but with help of this clinic, patients always have access to the most important drugs. This is important as around 40% of our children have epilepsy, and without proper treatment, this impacts the quality of life of the child and the family, and also reduces the effect of rehabilitation care. When the children have visited all the different stations, they will receive a porridge-based meal that is prepared with locally available food and shows the caregiver how to prepare food that is nutritious and more safe to swallow. During the feeding moment, the children will be observed and the caregivers will be guided for proper positioning. The clinic brings all the essential needs for the children and the caregivers together. It saves time and finances because they don't have to go to different clinics, and by receiving all the necessary care, including food supplements and assistive devices, the quality of life for both the child and the caregiver is improving.